Hey everyone, and welcome back to Coffeesodes. I'm Josh,
And I'm Kelly.
and we're brewing up episode number 45 today, diving deep into the world of AI and diabetes management. If you're looking for more specifics on the research we'll be discussing, as always, you can check out the episode descriptions. Diabetes is a global health challenge affecting millions, and those numbers are only projected to rise. What if we told you that AI could be the key to not only managing this disease, but maybe even predicting and preventing it?
It's a really fascinating area.
That's what we're exploring today, the potential for AI to transform diabetes care. Before we get ahead of ourselves, let's take a step back. What exactly are we talking about when we say AI? I feel like a lot of people hear artificial intelligence and their minds jump straight to sci-fi movies with robots taking over the world.
Right. It's definitely a hot topic right now, and it can feel a bit overwhelming. Essentially, AI involves training computers to learn and process information like we do. It's about recognizing patterns, making decisions, and even predicting outcomes based on massive amounts of data. In healthcare, this data could be anything from your blood sugar readings to genetic information to lifestyle choices, a whole digital snapshot of your health.
And when we talk about diabetes, we're talking about a lot of data. The research actually uses this fascinating term, digitism, to describe this intersection of data and technology in diabetes management.
Oh, wow, I like that.
It really highlights the sheer volume of information we're dealing with. Everything from our smartwatches and fitness trackers to continuous glucose monitors. And this is where AI steps in, helping us make sense of it all.
Exactly. It's not just about computers crunching numbers. It's about using that analysis to make a real difference in how we approach diabetes care. And AI's influence isn't limited to just diabetes. It's already having a ripple effect across healthcare. AI can analyze medical images like retinal scans to detect problems early on. It can help doctors stay updated on the latest research and even assist in training new doctors using electronic health records.
It's almost like having a superpowered assistant for doctors, helping them make faster and more accurate diagnoses for conditions like diabetes and high blood pressure.
Exactly.
That's incredible. So let's bring it back to diabetes specifically. What are some of the concrete ways AI is already being used to impact diabetes care?
Well, one of the most promising areas is in prediction. AI algorithms can analyze patient data identifying individuals at risk for developing diabetes or for experiencing complications like diabetic retinopathy or nephropathy. This early identification could be a game changer, allowing for interventions that might prevent these issues from developing in the first place.
So it's not just about managing diabetes after diagnosis. It's about potentially stopping it before it even starts.
Exactly. And AI can also play a role in making smarter treatment decisions. Imagine a doctor having an AI co-pilot that can analyze a patient's data, recommending the best medication dosage, or suggesting lifestyle changes based on individual needs and responses. These are known as decision support systems, and they have the potential to really personalize diabetes management.
And let's not forget about the advancements in wearable technology. Things like continuous glucose monitors, insulin pumps, smartwatches, all generating data that AI can leverage for even more personalized care.
Right. We've come a long way from relying solely on finger sticks to check blood sugar. Now we have these flash glucose monitors that continuously track levels. And even more advanced, we're starting to see the development of automated insulin delivery systems, sometimes referred to as an artificial pancreas. AI algorithms in these systems actually adjust insulin delivery based on your real-time data.
It's incredible how technology is revolutionizing how we approach diabetes care. But diabetes is more than just managing blood sugar. It can affect various parts of the body, leading to serious complications. How is AI being utilized to tackle these challenges?
As we touched on earlier, AI is being used to screen for diabetic retinopathy, which can lead to vision loss if left untreated. One study showed that an AI system called iArt had a sensitivity of over 91% in detecting retinopathy. To put that in perspective, that's a significantly higher accuracy rate than some traditional methods.
It's like having a second set of eyes, but with an even sharper focus, potentially catching those subtle changes early on.
Exactly. And early detection is critical, as it can often mean the difference between preserving vision and experiencing irreversible damage.
So AI is playing a crucial role in identifying and managing complications, and it sounds like this is just the beginning of what's possible.
Absolutely.
Well, then let's keep digging. In the next part of our deep dive, we'll take a closer look at how AI is being used to understand and predict complications like diabetic nephropathy and cardiovascular disease. We'll also explore what the future of diabetes care might look like in a world increasingly powered by AI.
Sounds fascinating.
Stay tuned.
One thing that really struck me in the research is how AI is being used to understand and even predict complications from diabetes. We touched on retinopathy earlier, but there's so much more to explore.
Let's dive a bit deeper into diabetic nephropathy, which is kidney damage caused by diabetes. This is a serious complication that can often be difficult to detect in its early stages.
Right, traditional methods of diagnosing diabetic nephropathy can be invasive and not always accurate, but AI is offering a new approach. Researchers are developing AI algorithms that can analyze blood tests, urine samples, and even medical images to identify those early signs of kidney damage.
It's like having a super sensitive early warning system for your kidneys, potentially catching those subtle changes before they progress.
Exactly. And it's not just about detection, is it? AI can also help us manage and potentially even slow the progression of diabetic nephropathy.
Oh,
And with remote monitoring capabilities, AI can alert doctors to any changes that need attention, keeping a constant watch on kidney health.
that's incredible.
Speaking of chronic conditions, let's shift our focus to another major complication associated with diabetes, cardiovascular disease. We know that people with diabetes are at an increased risk for heart attacks, strokes, and other heart problems. So how is AI being utilized to address these risks?
That's a good question.
One of the most promising areas is in the analysis of electrocardiograms or ECGs. AI algorithms can detect subtle patterns in ECGs that might be missed by even the most skilled cardiologist. This can be instrumental in identifying individuals at risk for heart problems, even if they aren't showing any outward symptoms.
So they can see things a cardiologist might miss.
Exactly.
It's like having a heart detective on the case 24/7, constantly analyzing for any clues that might point to potential problems.
Exactly, and that early detection could be life-saving, allowing for interventions that prevent a serious cardiac event. Another exciting area is the development of personalized risk scores for cardiovascular disease. By analyzing a patient's data, including blood sugar levels, blood pressure, cholesterol levels, and other relevant factors, AI can calculate their individual risk.
That's pretty amazing.
This empowers both doctors and patients to make more informed decisions about lifestyle changes and medical treatments, taking a proactive approach to heart health rather than waiting for a problem to arise.
It's a shift from reactive to proactive care, putting the focus on prevention and empowering individuals to take ownership of their health. And this brings us to another area where AI is making strides. Diabetic neuropathy, specifically those painful and often debilitating foot problems that can arise.
Yeah, diabetic foot ulcers are a major concern, and AI is being utilized to develop new diagnostic tools and treatment strategies to improve outcomes for patients.
So how is AI specifically being used in this area? What are some of the applications we're seeing?
Well, for starters, AI is being used to analyze images of diabetic foot ulcers, assessing their severity and predicting their likelihood of healing. This information can be crucial for doctors in making decisions about wound care and treatment.
Okay.
There are also AI-powered smart bandages and other devices being developed that can monitor wounds, remotely alerting doctors to any changes that require attention.
Oh, wow. It's a level of care and attention that would be difficult to achieve with traditional methods alone. And what about prevention? Can AI help identify individuals at higher risk for developing these ulcers in the first place?
Absolutely. AI algorithms can analyze various factors to predict which patients are most vulnerable to developing diabetic foot ulcers, allowing doctors to focus their efforts on prevention and early intervention.
So they can focus on preventing them before they even start.
Exactly. By identifying those at highest risk, healthcare providers can provide targeted support and guidance, potentially reducing the incidence of amputations.
So it can really improve people's lives.
But it's important to remember that with all the amazing potential AI offers, it's not a magic bullet. There are still challenges and limitations that we need to acknowledge.
Yeah, it's important to remember that.
You're absolutely right. AI is a powerful tool, but it's just that, a tool. It's not a replacement for human judgment and expertise. Doctors will always play a vital role in diagnosing and treating diabetes and its complications.
Right, so AI is a tool that can help them, but not replace them.
Right. One concern that often comes up is the potential for AI algorithms to perpetuate existing biases in healthcare. How can we ensure that AI is being used fairly and equitably in diabetes care?
Yeah, that's a really important point. How can we ensure that it is being used fairly?
This is a critical issue and one that researchers and developers are actively working to address. One approach is to ensure that AI algorithms are trained on diverse data sets that represent the full spectrum of the patient population.
Okay, so the data has to be diverse.
We also need to develop mechanisms for monitoring these AI systems and identifying any potential biases that might emerge. It's about being vigilant and ensuring that AI is used to improve healthcare for everyone, not just a select few.
Right, for everyone. So is there anything else we should be thinking about?
Data privacy is another important consideration. AI relies on vast amounts of patient data, so how do we protect that information and ensure it's being used responsibly?
Yeah, that's a good question. How do we protect the data?
There are strict regulations in place to protect patient health information, and AI developers are working hard to build privacy safeguards into their systems. Another potential concern is patient over-reliance on AI. Is there a risk that individuals with diabetes might become too dependent on these systems and neglect their own judgment or the advice of their doctors?
Yeah, I could see that being a concern. So how do we make sure people are not overly reliant on the AI?
It's crucial to emphasize that AI is a tool to support, not replace, human decision-making.
Right.
Doctors and patients need to work together using AI-generated insights as a guide, but ultimately making treatment decisions collaboratively that are in the best interests of the patient.
It's a partnership finding the right balance between technology and human expertise. This leads us perfectly into our next topic, which delves into a more futuristic vision of healthcare. The concept of P7 medicine, which stands for personalized, predictive, precise, preventive, pervasive, participatory, and protective healthcare.
Yep.
It's a glimpse into a future where healthcare is truly tailored to the individual, shifting the focus from reacting to illness to preventing it altogether.
Yeah. What might a typical day look like for someone with diabetes living in this world of P7 medicine?
Okay, let's imagine you wake up in the morning and your smartwatch equipped with a continuous glucose monitor has been tracking your blood sugar levels all night. It notices a slight upward trend and gently vibrates to wake you, suggesting a light breakfast with a specific protein-to-carb ratio to help stabilize your blood sugar. You follow its advice, and within an hour, your blood sugar is back in a healthy range.
Okay.
It's like having a personal health coach right there on your wrist, providing real-time guidance.
And that's just the beginning. Throughout the day, your smartwatch and other devices continuously monitor your health data from activity levels and heart rate to even your mood. This data is then analyzed by AI algorithms, identifying potential risks and offering personalized recommendations to help you stay healthy. Imagine receiving a notification suggesting a 20-minute walk in the park because your stress levels are a bit elevated, or getting a reminder to schedule your annual eye exam because your AI-powered risk score for diabetic retinopathy has slightly increased.
That's amazing. It's like having a personalized health concierge, constantly looking out for your well-being and nudging you towards better health. And it's a vision that's well within reach.
Right.
One thing that really stood out to me in the research was the emphasis on patient empowerment.
Yeah.
P7 medicine isn't just about doctors and technology. It's about providing patients with the tools and information they need to take control of their own health.
Right. It's about moving away from a paternalistic model of care towards a more collaborative approach where patients are active participants in their healthcare journey.
And that shift is incredibly powerful.
And this type of technology could be particularly transformative for individuals who live in rural areas or have limited access to healthcare.
Thank you, Kelly, for sharing your insights and expertise with us today. This has been an incredibly thought-provoking conversation.
It's been my pleasure, Josh.
And to our listeners, we'd love to hear from you. What excites you most about the potential of AI in diabetes care? Share your thoughts and reflections in the comments below. Until next time, keep those coffee cups full and those minds curious.